Hello, and thank you so much for the warm invitation. And it's an honor to be here. And my name is Fraser, and I think I have, no, I don't, RDJ Fraser on Twitter, if you're looking for me. And it's an honor to be here as a registered nurse and a colleague, but also as a patient from motorcycle accidents and some other fun things. It's just great to be here at this conference. And today I have the honor and privilege to talk about the Connecting Nurses Initiative, which is a global initiative, and it's a lot of fun to be part of. It is an initiative that is led by Sanofi, but in partnership with nursing organizations around the world. And its goal is really to bring together nurses online and in real life. And instead of kind of trying to duplicate and say having a social network online, that's really neat. What we're trying to do is do strategic kind of initiatives underneath this Connecting Nurses project and experiment in different ways that we can really help and support nursing and sharing of ideas globally. So what I'm going to talk today about is one of those projects, the first that we launched and piloted and we just finished, which is Care Challenge. So just for my own interest, is anyone else here a nurse? Okay, now one other person, that's good. Anyone else in the audience related to a nurse? Oh, there's 3 or 4 or 5. And anyone else know a nurse? Okay, so we all hopefully know nurses. But nurses do many different things. And can anyone have a short explanation of what nurses do? Everything. What doctors don't want to do. And I don't know, yeah, we do a ton of different things. And it's not always easy for nurses to be able to talk about what they do. We're very focused on patient care and delivery, and we're recently coming more into the kind of research world and sharing knowledge and disseminating it. But we're involved in healthcare work all over the place. And this, getting to the point of Bart this morning, is why I'm interested in this. Ideas are extremely powerful, and when you share those ideas, incredible things can happen. And traditionally, the nursing profession has been a bit private, and we go about our kind of work and do our thing. When I was doing a site visit to a hospital in Europe, there's a picture of very notable paintings, and the nurse was putting flowers into a vase, and then you had physicians that were, they had medals and plaques and awards, and there's museums all over the hospital dedicated to what they do, but the nurse's work was putting flowers in a vase. So often that work is hidden, and that's why this community really excites me. So the Care Challenge website was meant to recognize ideas globally. So instead of being a supporter and incubator that just kind of takes in applications and then tries to give out support privately, what we wanted to do was take in those ideas and initiatives that are being led by nurses and push them back so the whole community could see what was going on. So nurses in Canada could see what was going on in Spain. So nurses in Tonga could see what was happening in the Philippines. And they could decide what initiatives did they think were important, and they could vote on them, they could comment on them, they could get in touch with other people that were leading projects. And everything that was submitted was then publicly available for others to get in touch and collaborate with. And the initial first kind of round, we had 2 different types of support that we were trying to offer, which is a bit of seed funding, money to help get nurses off the ground. They had ideas about patient care that they wanted to do. They had ideas about research that they wanted to try, but they might not have had the resources in their organization, because now funding can be very tight. You might need a multi-site trial. You need a lot of government support. So we wanted to see how could we just get them off the ground and get them started. And the other part was recognition. So if a nurse had done an incredible project, how could we then recognize it and get that spread? So recognizing nurses and putting them in the limelight. So we're offering them professional video production to help spread their idea across their country and globally, which is very exciting. And it just finished on Monday. We announced the 20 winners, and we're very, very excited because we did have projects from around the world. The top submissions, or the most projects, were submitted from Canada. Then we also had Morocco in the top 3. We had over 120 projects. We had votes from nurses supporting initiatives, and a lot of them got up into 5,000 people submitting to support an initiative and recognize it as an idea for excellence. And to give you an example of some of the things that are happening, there's a telehealth project in the Philippines that we're trying to recognize that's doing elderly support to their communities. There's wound care and ostomy care management that's happening in Tonga and trying to get that out to community healthcare workers. In Ireland, there's people working on epilepsy projects and making sure that we're actually doing holistic care, not just getting access to treatment, but education for patients. And then another great example that we just found out about was, and was a winner, but they're doing virtual support from nurses for HIV patients. But not only did they get some support for their project, but now they've partnered with international organizations to make it a multi-sided kind of project that they're going to start to explore collaboration. So that's the why I think it's important, and hopefully you guys are a little bit interested in. During questions we can talk a bit more. Thank you.
Thank you so much.